English and a little bit Malayalam.
Okay. Respected Dr. M.R.V. Nambudiri sir, beloved Dr. Mahadevan, dear friends. Today, we have a great guru with an extraordinary Shishya with us. Dr. M.R. Vasudevan Nambudiri and Dr. Mahadevan. We are highly privileged by the presence of these Ayurveda stalwarts. Doctor, there is no necessary to introduce these two figures in the Ayurveda field. As you know, Dr. M.R. Vasudevan Nambudiri sir is the former Director of Medical Education, Ayurveda Kerala, and was the got the Dhanvantari, one of the best awards, Dhanvantari Award of the Kerala government, and he was in several Ayurveda committees as a scientific member, like CCRAs, all. Still he is, and he was a former CCM member also. Fortunately, he is my classmate in PG and my boss in my service. And he is the Prayokta of Suddha Ayurveda. He motivated thousands of students and in the way of Suddha Ayurveda. Nothing more I want to say about him. Everything everybody knows about him. Dr. Mahadevan, a renowned person in Ayurveda, he is one of the best clinician, best orator, best teacher, everything, what not, he is. I first saw him in 1995 when he was a student of the first PG in Trivandrum Ayurveda College. At that time itself, I recognized his capacity, and now it is correct. Dr. Mahadevan is a PhD holder and the grandson of Vaidyasri Mahadeva Iyer. He is teaching and practicing, and one of his important is he's documenting everything which is lacking in Ayurveda. His clinical classes are unique in nature, and he published 72 books, 43 in Tamil and 29 in English. He got several awards, like the prestigious award of Acharya Award of CCIM and Best Scientific Writing Award of Rashtriya Ayurveda Vidyapith. In this pandemic time, in COVID, yes, there are several patients to treat individually, and that experiences he will share with us. Fortunately, he is practicing in Tamil Nadu. That is why he got this chance. It is very sad that in our state, it is not still accepted by the authorities. He is relentlessly working for the inclusion of our system in the mainstream of COVID treatment. Central government, AYUSH department is continuously writing to state governments the new protocols to treat our system. But with our efforts, at least for preventive sector, we are interfering from the May last week, and formed a COVID Ayurveda state Ayurveda COVID response cell. And this cell, from last week of May to July 3rd week, they given our medicine through ISM clinics and hospitals to 157,000 persons. And out of them, only 577 only got this COVID, and for them also it was not very serious. And out of these 577, none needs ventilator. So this all proves, and All India Medical Ayurveda Medical Institute is also doing work on COVID with Ayurvedic medicines and other protocols. So I hope that definitely our system will accepted by all in the near future. Now the COVID response cell of state is working on post-COVID syndromes, and they say good response are getting. I'm not taking your time much. You are eagerly waiting for the remarks of Dr. MRV and as well as the lecture of Dr. Mahadevan. With great pleasure and honor, I invite Dr. M.R. Vasudevan Nambudiri as the moderator for his opening remarks. Thank you. Sir.
Not hearing.
Sir.
Sir, കേൾക്കുന്നില്ല sir.
Sir, unmute ചെയ്യണേ sir.
Sir, we are not hearing you.
Now, can you hear me?
Now.
Oh, okay. I think now you can hear me.
Yes.
Now
yes.
Is it okay?
Okay, sir.
Thank you, Dr. Vinod Kumar, for your good words about Dr. Mahadevan and me. Anyway, I am very thankful to the organizers of AIMA for giving me a chance like this. And Dr. Mahadevan had treated many cases of COVID as inpatient. In Kerala, we are not having such facility for treating COVID patients as inpatients. Myself and Dr. Vinod Kumar might have treated many cases as OP. Over the telephone, we might have treated many cases. But as IP, we have not treated. Anyway, but Mahadevan had treated many cases and he is having hands-on training to how to manage this COVID cases. I think better than a modern medical doctor. Hence, definitely he will be able to give us a clear picture about how can we manage a COVID case. This is very informative to the doctors of Kerala because we are not having such experience. Anyway, I am very proud to be the moderator of this session because Dr. Mahadevan is one of my best students from the for post-graduation. I was his guide, and from that day onwards, he was working relentlessly for the growth of Ayurveda. Anyway, once again, I am thankful to the organizers. Mahadevan, let us start. I think
sir.
you can put in the cases one by one. Thank you.
Sir. Thank you, sir.
Thank you.
Thank you, sir. Respected Guru, my beloved Guru, M.R. Vasudevan Nambudiri sir, respected Vinod sir, dear brothers and sisters of Ayurvedic community in Kerala. COVID is a big problem, and 8 months before we were studying the theory, and we have made concepts about prevention. Here in Tamil Nadu, government is promoting Siddha medicines, Nelavembu Kudinir, that is Bonimbam, and Kapajara Kudinir, which is Tiktakadurasam Ushnaviryam, Kafavadagaram in nature, Agni Deevanam in nature. They are given in allopathic hospitals also. So usually this is the 4th or 5th time I am giving this class on COVID. You would have heard this before. So in Kerala, there is no need to talk about Janavadodamsam, Sankramandi, Naram, all these things, because you know all these stories. Prasangad, Gatrasam, Sparshad, all these things. So government has made a lot of effort here. And previously cases were very high in Tamil Nadu. And after 6 months, still cases is increasing. Now, since it is reducing, traditional medicine has got a great role, whether Ayurveda or Siddha. Lenience in the restriction has not brought the situation under control. It has affected the economy. I closed my hospital for a long period. Then we opened it, and people were afraid to take the test. Then we educated them to take the test. I myself had tested very frequently because of fear. And we were taking CT scan also. And I had an opportunity to treat a VIP person, and he was completely cured of this disease within 7 days with all symptoms. And we got an opportunity to, he introduced me to a great person in this district, who is a DM cardiology, who is having an interventional cardiology center, which has government approved COVID hospital. And he gave us permission to treat and give Ayurvedic medicines in an allopathic hospital. So we admitted because it's a government approved COVID hospital. So myself and my team have done treatment to more than 30 patients. Now it has crossed 75 to 100. The actual documentation, because the tests were very expensive, I will tell you what we have done. 30 COVID patients, a government approved COVID treatment center at Vasantham Healthcare Private Limited, Tennyson Road, Nagarkovil. A preventive management in Ayurveda to a total of 50 doctors, 50 working staffs in the hospital was also ensured. Doctors Kanakamina, Ajit Kumar, and 4 of my junior doctors were posted completely in the COVID unit. And cardiologist Dr. N.V. Venkatraman was our allopathic counterpart, who helped us in understanding the disease prognosis and placed faith in Ayurvedic management. COVID-19 caused by SARS-CoV-2, an RNA virus, was altered as a pandemic in the beginning of this year. This is all you know. Kerala, the situation was very good, and suddenly cases were increasing. Here also it was like that. Now cases are coming down. Ayurvedic contribution in COVID-19 crisis has been helpful in preventive management of asymptomatic cases, mild cases, moderate cases, severe cases, cases with comorbidities. I got an opportunity to treat all these varieties. So we have divided this group into preventive management. Group A and Group B, first we are divided. In Group A, strongly exposed to COVID-19 patients, we have selected the people working in that hospital, doctors, allopathic doctors, Ayurvedic doctors, radiology technicians, lab technicians, and nurses. This is Group A. Group B, weakly exposed to COVID-19 patients, including hospital management staffs and cleaners. First, it was given to doctors and nurses, Group A. Group B, non-clinical staffs, cleaners, management, mess workers, etc. Then protocol. First group, asymptomatic patients, then mild to moderate patients, then fever patients with diarrhea. Now the pattern has changed. At that time, 2 months before, the presenting complaint here was diarrhea. diarrhea with fever. Jwaradisanam is a separate chapter in Chakradatta. And patient with comorbidities that include patient with diabetes, patient with hypertension, patient with diabetic kidney disease, patients who have undergone CABG, coronary artery bypass grafting. Sir was very kind to give that patient also with their willingness to get treated with Ayurveda. Patients with severely affected lung disease. In here, we had an integrated approach. So patients were given different management based on the avastha. So there was no particular single medicine based on the avastha. I will present one case in every category because within 45 to 50 minutes, and then we have time for discussion. One case from everything. Group A, strongly exposed to COVID-19. Group B, weakly exposed to COVID-19. The first group includes doctors, our doctors and their doctors, radiologists. So we were giving them, starting with the Jara Chikitsa, Tiktarasa Pradhanya Ushadas. So you can do Pajanam with the Tiktarasam or Kadurasam, Tikta Pajanam, Kadupajanam. Tiktam is Pitta Shamanam, Kapasamanam, Pittam is Snigdam, Kapam is Snigdam. So Tiktam is Lagu. Nambudiri sir used to say and taught me again and again and again. For Adura, the best rasa that can be used is Tikta, and the best rasa for Swastha is Madura. A treatment starts with Tikta and ends with Madura. So Pachanamritam, Sudarsanam tablet, and Agni Deepanam after this acute phase was over. Then they were given Shavanaprasam, and some cases we were given Indiganda Gradam or Shatfala Gradam. Group B, that is non-clinical staffs. So phase 1, what we did COVID-19 real-time PCR, real-time reverse transcription polymerase chain reaction. And CT was performed as a screening method because it has got high sensitivity and present prognosis, and the results are available immediately. Within 5 minutes, we get the results of CT. CT facility was available, and concession was given to the patients. We helped the patients. Few good-hearted persons helped us. And the CT swab test at that time, government was taking 1 day to give the report. Positive results every day evening they were giving. Negative results came late only. So the CT helped us to understanding and the difficulties. So all the patients admitted, we did all these things. When they're COVID positive, the next step is complete hemogram, C-reactive protein, erythrocyte sedimentation rate, kidney function test, liver function test, ferritin, D-dimer, lactic dehydrogenase, and since 2 months, interleukin-6 urine analysis. All these tests were done before and after for all the cases. So it was a very expensive procedure. 15 days of admission, the patient is advised to repeat CT. And some patients we admitted repeat CT after 21 days. Some patients after 1 month, because we found in diabetic patients, the CT changes asymptomatic, they became within 10 days. But even after 21 days, CT findings were same, and it took 2 months for the resolution of the changes in the CT. So CT results, lung affected below 30%, they were advised to discharge with Indugandham, Shavanaprasam, etc. If they are diabetic, Shavanaprasam is not given. If lung affected above 30%, they were advised hospitalization continuously, and the interleukin was tested. And PCR is very specific, but a lower sensitivity rate of 65%. Now you see this in the CT cuttings. Day 4, ground glass opacity lesion locates peripheral and subpleural region. On the 9th day, progressive ground glass opacity in the B. On the 14th day, more opacity. And in the 19th day, you see resolution. So in the middle B and C, you see the ground glass opacity more. The normal CT, new ground glass opacity in B, and C, it is much more. After 14 days, there is a resolution. So there is these radiologists who worked with us. They have grading less than 5% involvement, 25% involvement, 26 to 49% involvement, 50 to 75% involvement, 75% involvement. The total CT score is the sum of the individual lobar scores and can range from 0 to 25. Maximum involvement when all the 5 lobes show more than 75% of the involvement. This is 0% CT, normal CT. This is less than 5% CT. This is 5 to 25% CT. This is 26 to 50% CT. 51 to 75%. You see the right and left lobe, complete opacity you are able to see. Greater than 75% CT. D-dimer. D-dimer is the clinical marker for pulmonary embolism. D-dimer greater than 2 microgram per ml, fourfold increase could be mortality in patients with COVID-19. So we checked D-dimer on the day 1. Elevated level of ferritin. Ferritin is increased in liver disease, rheumatoid arthritis and all. So in anemia, it is very low. So inflammatory marker, it is an inflammatory marker. And lactic dehydrogenase, the cytokine-mediated tissue damage, the Dhadubhagam and other things, LDH will be very high. LDH is also very non-specific, but it is correlated with clinical condition and other tests. Interleukin-6 inhibitors may ameliorate severe damage to lung tissues caused by cytokine release in patients with serious COVID-19 infections. And total protocol, group 4, we had people with comorbidities. And I will send a representative of each case. Day 1, that is asymptomatic patient, a doctor who was taking care of these, all the COVID 50 bedded, 100 bedded hospital for COVID, 50 bedded and 30 bed, we were giving our medicines. COVID positive day 1, day 6 blood test was given, patient came on day 6. COVID test became negative on 9 days, and he was discharged. How did we manage? So 37, he was admitted with asymptomatic. A test was given, PCR positive. Then nothing specific was there. So we do Amabhajana, Agni Dimana. Tikta Kadurasa was selected. Madaram you cannot select. Amulam you cannot select. Lavanam you cannot select. Kashayam, Shidam, Guru, Stambanam you cannot select. Tikta Kadu combination is the best combination. Tikta Vajanam, Kadu Vajanam. If it is Kafanavandam, Kadu will be given more importance. If it is Pittanavandam, Tiktam is given importance. Shadangam is given importance. Sudarsanam is given importance. Because Tiktam and it varies. Many people think it is Vada Kapha or Kapha Vada only. But Pitta presentations were also there in some of the diabetic persons. So Pachanamradam and Trigudu was given. Trigudu is a simple medicine but very effective medicine. And this case, you see this, COVID was positive. COVID was positive and all the blood investigations were done. COVID became negative on the 9th day. It's simple medicines. And he was discharged. Now group discussion. Savanaprasham is given after the Agni is corrected. Patient, this group showed no symptoms and tested COVID positive. The important aspect is to keep the patient under observation. We kept them under observation so that they should not get these complications of COVID. So we were watching Agni, Ama, Kosta, Nidra, Sattvavala, along Ayurvedic and modern parameters, oxygen, everything where our doctors were given all these protective equipments and trained. And Pasanamradam Trigadu were given and Savanaprasham was given in these patients. Immunity was Vyadhi Bala Virodhitvam, Vyadhi Utpadaka Pratibandhakatvam, immunosuppressive and immunomodulatory is the Vyadhi Bala Virodhitvam, Vyadhi Utpadaka Pratibandhakatvam. Patient was advised to take, and we prepared food for all these patients with appointing 2 cooks. A complete rest was ensured in the hospital stay. Then mild to moderate patients in the group 2, day 1, they become positive, and the day 12, they were discharged. Here, dry cough and cold was the picture. Dry cough and cold and nose block at night time and vomiting sensation, cough was more, and PCR was positive. So here cough was there. There are 2 important popular kashayas. I studied this only after coming to Kerala from Nambudiri sir. Patyakustumbaradi kashayam. Sudarsana Churnam was given. Sidobaladi, because Madhura Rasa, it was added with Vibhidagi. Sarveshu Swasakaseshu Kevalamba Vibhidagi. So it was added along with that, and this was continuing in the group B category. So the group B category were undertaking, and the interleukin test was also done, and the repeat PCR were negative. You see, the PCR is positive, ESR was elevated. We took CT, focal areas of small ground class pneumonitis feature multifocal pneumonitis cohort 4/5 is the result. You see these opacities. Our name is there. COVID negative. And in the repeat CT, after 15 days, in non-complicated cases, the opacity in the lungs also changed. No significant abnormality detected in the CT scan. A discussion. The patient group had varied symptoms and treatment was customized into individual symptoms. They were largely, in general, we prescribed Patyakustumbaradi Kashayam. If you read the Palasruti of Patyakustumbaradi Kashayam, the upper respiratory pathway involvement is very clearly mentioned. Sudarsana Churnam, it contains Bunimbam. Bunimbam is Dikta Samana Badanam, Shodana Diktam, Samana Diktam. Kadarogini is Shodana Diktam, Bunimdimam is Samana Diktam. Then Vibhidagi was given. Then Vyadimuktasya Mandagno, Sarpireva the Debanam, Snehameva Param Vidyad, Durpla Analadivanam, Indaganda Gradam, the wonderful medicine, the medicine liked by my guru, Amar Vasudevan Nambudiri was given. And Siddhobaladi is Madhura Rasa Amavardhana. So Vibhidagi is added with that. Then group 3 cases, COVID positive, then COVID was negative. What was the gas? It was a gastrointestinal presentation. Loose bowels, continuous loose bowels, body pain, throat irritation, diarrhea, all these things were there. So in Juradisara of Chakratatta, one Kashayam is there, Ushiradi Kashayam, I will tell the yoga. And then Vilvadi Guliga, what is given in Kerala every day. Only thing we got an opportunity and permission, that's all. Vilvadi Guliga was given. Then Dadimastaka Churnam was given. Saptachadadi Kandusham, Kadiradi Vadi were given. And slowly, this is the same medicine, simple 2-3 medicines only given. Then repeat blood tests were there. This is positive. You see this? Small patchy pneumonitis in the medial portion of the left lingular lobe along periphery. No other significant abnormality. Then it became negative. After the CT scan, no significant abnormality detected in the CT scan of the study. So what does it indicate? Mild cases, exposed cases with comorbidities which are asymptomatic, exposed cases with fever, exposed cases with mild URI, exposed cases with positive cases with diarrhea and other features are successfully managed. Not even a single failure in the management. Ushiradi Kashayam, Vilvadi Gudiga, Dadimastagam, all these things were given when they were going home. Indaganda Gradam was given to these patients. Now patients with diabetes patients who have undergone bypass surgery, where they came with body pain, nausea, cough, fever. Day by day chart we have done. So PCR was positive. Diabetic patients. So comorbidities are told us to be very, very careful. And these modern doctors were also parallelly assessing. So Patyakustumbaradi, then we selected Darunakaradi Kashayam. Wonderful Kashayam. Unfortunately, this is a bad fellow. He is not very lucky to be talked about. But Darunakaradi is the Patyakustumbaradi is best in my experience with the Shunti tablet as Prakshebam. Sudarsana was given. Nishagadagadi Toyagalpana. Nambudiri sir used to say for Pittavadam Nishagadagadi, Kafabittam Katakadiradi. So Nishagadagadi Toyam was given. Then diabetes. In those who are taking insulin, they were allowed to take insulin, and modern medicine we didn't interfere. We were managing the COVID pictures, not the diabetic picture. So this was the then discharged. Then they were advised to continue Patyakustumbaradi, Darunagaradi for a little more longer period of time. The CT chest, like the previous cases, did not show changes. mild patches were still there even after a longer period, and but they were asymptomatic. They were advised to continue the medicine. It took long time. So the bala, Vyadikshamatva, we understood. The Kleda Vriddhi in diabetes, the importance of Kleda, Dadu Shaidilya. We were Dadu Vardhi, Dadu Kshayam, Dadu Bhagam, Dadu Dushti, Dadu Shaidilyam, Dadu Asamagatvam, Dadu Astiratvam. So many varieties of Dadu disturbance is told. But here in the CT, it took longer time for changes. Positive, case was positive. Other tests were done. You see, the picture is also more areas of dense class pneumonitis with septal thickening in the posterior lateral segment of the light lobe, bronchiectasis, all these things. Lesion involving 15% of lung, mild COVID pneumonia, 4/5 invert COVID pandemic, RT-PCR is suggested. So you see this, the big opacity in the right part of the lung, in the middle part and the left lower part. Dense ground class pneumonitis in the lateral segment of the light lobe. In other cases, when we repeated the CT, it went away completely. But in diabetic patients, they become asymptomatic. But CT changes took long time to get changed. It took even 30 days, 35 days, 40 days to produce CT changes in CAD patients and coronary patients. But it is Kafasthanam, Kafavriddhi. So Kafam is Nigdam, Kredayuktam. So Kadurasa Pradhanya, Patyakustumbaradi, Kadadiktam, Shunti, all these things you are given. Again, because of Tarasa, Kadurasa Prayoga, Ushnavirya, and repeated, there is Vada Vriddhi of Tarasa, Kadurasa Prayoga. So the treatment for Vada should end up in Snegana, Agni Deepana in nature. So Indaganda Gradam, which is Purana Jwarahara Visheshatvam, has been selected. Now, patients with hypertension. Hypertension is a very crucial area because it's suffered in this area. Suppose hypertension is a Vada predominant disease, you should respond to Gandharvasthadi, Sukumaram, etc., Dhanandaragudi, etc. If it is a Pitta Pradhanyam, you should respond to Drakshadi, Avipati, Chirabala, Panchagandha Churna, Talab, like that. If it is Kava Pradhanyam, you should respond to Varunadi, Punarnavadi, Dasamalari, Namagugulu, etc. But this is Gudaling, Abhyaktavyadi, asymptomatic. And Sarpakanta we are giving. Sarpasukanda is introduced in Ayurveda first time in Dandi Haridagi in Gulma Chikisa. That is the Sarpasukanda is Iswaramuri, Garadapudi. It is not Ravalfia. Ravalfia is a Vishakaradravya used in Susrada, Uttar Samhita. But actually it's an invention of African scientists who used it as antihypertensive drugs. So in COVID positive patients, the hypertension greater than 160/100 we struggled to handle, and we allowed the modern doctors to teach. Same medicines were given. We were able to add only Brihatyadi Paniyam for that. And Rasna the Dhumavarti was given because these people lost smell. So Dhumavarti, this is Kafa Avrada Vadam Indriya Pradosha the Vyadi. So the Rasanadi Churanam is made into Varti, and it was inhaled through nose and exhaled through mouth, and it produced very good results. But hypertensive part, modern medicines, they like based on the need calcium channel blockers, beta blockers, AC inhibitors, ACB, receptor blockers. We didn't, we asked for them to continue, we didn't intervene. But other lakshanas of this COVID, the smell, modern medicine, but within 2-3 sittings of Dhumana, this smell problem was correct. It was positive. And you see this? Subpleural small ground class pneumonitis, Corat 3, intermediate COVID. Is intermediate COVID. You see the picture? We have got CTs now, full, all the CT documents. Everything is there in our hospital. Study is still going on, 100 cases. We have crossed. We are not doing all the tests now. We limited tests only. We are doing CT also. Clinically, we assess and send them because cost effectiveness. It was a study, so all the investigations were positive. Subpleural ground class opacities, posterior segment. As compared to previous study, resolution is noted. There is better, but not completely cured. That's I told. We were forced to give Shamana Aushadas for a longer time, Indugandagradam for a longer time, Shavanaprasam in non-diabetic persons for a longer time, if the comorbidities are present. CT changes take longer time, but the Lakshanas goes away immediately. This is the score they are using. There is no time today, and negative it became after the treatment, it negative. Mild peribronchial thickening in bilateral lung fields, no other significant abnormalities. Discussion. Patients were hypertension and they were obese. Obesity is found as a comorbidity. Same kashayam was given, and some mutra virajaniya shofagna aushadas were added, like Brigatyadi, Dashamulam were added. Indugandam, at one stage, Induganda kashayam was not giving result, so we went to Dharanagaradi. Probably Dharanagaradi also contains Dashamulam. Dashamulam is not available. So we prepared, we didn't give this bottle kashaya. We prepared the kashaya in the kitchen, which is in the bottom floor of the hospital. Now, COVID positive patients with renal dysfunction. Many patients we have treated, and I will say one sample case. And they had fever, tiredness, urea creatinine were high, and two approaches are there. Udara chikitsa, Shofa chikitsa, Panta chikitsa, we have to incorporate and treat the renal problem. Adipravrti is there, apravrti is there. Apravrti, the patient is unable to pass urine. Less than 400 ml is called polyuria. So here we were giving one margam is affected. Nityameva Virajaya, this is Chikitsa Sutra. But Virajanam, is it possible in an allopathic hospital and in Jwaravastha? This is not possible. So Tiktarasa Pradhanya Aushada, Malasanjayam, concept of Malasanjayam was taken. So Kafam is Snigdha, Pittam is Snigdha. So Tiktarasa Pradhanya and Shofam Tridosham Prabuddham che. There is a yoga called Bunimba Mahaushadasta. The next word of Ajajibada Adi Churnam. Bunimba Mahaushadam. Prayogam. Bunimbam already popular in Tamil Nadu. Everybody Swarchia, Cerata, Andrography, Spanigulata, and Trigadu. The Bunimba Mahaushada Prayogam was given. Buduchi Adis, Buduchi reduces Snigda Guna Yukta, Malaruba, Afa and Pitta, and it reduces Jara, it is Pitta Samana, it is Kapha Samana, it reduces urea and creatinine, and this was given in this case. Here we did not select Indugandam or Patyagustum Bradi. So this was the approach we given in the patient. COVID-19 positive, urea and creatinine were high, CRP was very highly positive, and COVID became negative. So here already I explained Guduchyadi Kashayam, why it was selected. Brigatyadi was also given intermittently, and Trigadu was given. Tiktarasa Prayoga, Kadurasa, and Nityameva Virajaya, we were unable to do. Mutra Virajaniyam, Pellandalapache, Avil Tola, the Basmakanji Bole, Kudukan, Patila, we were knowing, but we were unable to give. So this case, coronary artery bypass grafting, this patient has undergone, and he developed fever and all routine features. And from my experience, I feel except pregnancy and fracture, COVID can present in any form. One fellow came with hiccup, a persistent hiccup. He was not responding to Nayabayam, Dhanandragudiya, Mayura Picha Surnam, Muhur Prayogam. Nothing was Lajapaniyam, Chardini Graganaganam. It was not responding. Then we took CT and COVID test. COVID was positive. The presenting complaint was hiccup only. So that's why I tell my students, Tamasha Cholme, except pregnancy and fracture, any manifestation, it can come. Like that, we are able to see multiple varieties of cases. And in these patients, even though they have undergone CABG, they were taking cardioprotective drugs. You are knowing that statins, ramipril, clopidogrel, aspirin, etc. Along with that, we give our medicine, and we give Arjunarishtam along with that, or only one. Barring then fever in these patients, fever coming and going, Vishmada. Whenever there is Vishmada, Alpoidosho, Dushade Labda, Anyadamo Balam, So whenever there is Vishamada, you see in our Shastra, Barangi is told. In Raktagulmam, in Anartavam, Adhyartavam, Barangi and Thilam is told. In Apasmara Chikitsa, in later texts, Lina Avastha is there. Doshas will be vitiated and they will be hidden in the dadus. When suitable circumstances come, they get provoked and produce the diseases. Yet there, Barangi is told. Then in Tamagaswasam, Barangi Gudam is told in Penis Adhyaya of Chakavat. Then Barangi is also told in Vishamajara in Kerala text. So Dhanvandar Gudiga Mugur was given for dyspnea and tiredness. So Barangi was given. Then after Barangi, then became all that. We changed it to little Madhura Rasa because very dry, coarse sound were there. So Nayobayam, Dhanvandaram, Mugur, we changed it. Nayobayam is a wonderful medicine. Interleukin test ran for all CABG patients. COVID became negative, and multifocal ground class pneumonitis in both lower, middle, upper lobes, predominantly along the periphery, predominantly in lower lobes, with all these things were written. Small, thin cyst formation, few prominent pre-paratracheal and pre-vascular regions. And nowadays, we are forgetting how to treat so common cases because every day reading Yorajikissa only again and again. So this case become negative. And you see this dense ground glass pneumonitis in the lateral segment of the lobe. And again, asymptomatic, symptomatic, mild symptomatic, moderate symptomatic, without diabetes and hypertension. All these cases with diabetes and hypertension. Avyakta Lakshanam and Lakshanam, Murdu Lakshanam, all these symptoms went away. Other complicated comorbidity cases also, we had very good results. The only problem is CT changes and D-timer and CRP took long time to come down. Patients with severe lung involvement, nasal block, dry cough, fever, COVID positive, we were about to get ventilator support, high fever, we were given added Vettumaram Gudiga, Thali Sadi, Kasturi Gudiga, based on the Avastha, Barangyadi Kashayam, all these things were given. Our doctors were standing and they are taking risk. I appreciate them here. All the four, Kanakamina, Ajit Kumar, Aishwarya and Jaya, and for this but luckily they were taking medicines till now due to God's grace. Our team, and none of the team members get COVID. They were with patients, they were assessing the patients, they were helping the patients. Till today, they did not get any. We were taking the test every 15 days out of fear, and they were not having any complications. Now you see multifocal consolidations with ground glass densities and small ground glass pneumonitis. You see that? And after the treatment, after 1 month, no significant abnormality detected in the CT. CT changes came, but came late. Positive became negative. So here, many medicines we were about to go to ventilator case. So I have talked about the merits of Ayurveda. I have to talk about the negative aspects also. 2 deaths we observed. I will talk about the 2 deaths. Man came with oxygen saturation 60, 1030. We were trying all these medicines. At 230, he died. So another person also, in spite of same approach and committed, sincere, honest approach from both the sides, we have seen deaths also. So Patya Kustumbaradi Kashayam, Barangyadi, Susasanam, Trigudu, Vettumaram, Kasturi Gudiga, Rasnadi Varti. Then all the Agni, all these is over, Shavanaprasam, Digandam were given. So some of the preventive lifestyles, I think Kerala people know this. Diabetic patients, we did not give fruit juices, and some Agni was given maximum importance. We were giving only vegetarian food to the study group, and black gram was avoided, and Udikina Vellam, ginger, coriander, tulasi leaves, Hriberam, Ustra, Adamodam, turmeric were boiled, and Toya Kalpana was given. Ginger tea were given to all the patients. coffee, tea were avoided. Nasyam was avoided because Anadelam, even though somebody talked about this, we completely avoided Nasyam. It is not needed whenever there is cold, fever, cough, throat pain, periods, rainy season, and Nasyam was avoided. Aparajitatuvam also we didn't do it in the modern hospital. In our hospital setup, we are doing from Kerala. I understood it has got wonderful effect. This medicine became popular now, and hygiene were advised. Satsachadadi Kandusham, Agni Balamas in given importance. After recovery complete, Tyagaraja Dailam was advised to take bath. And now, 6 months before what we treat, 5 months before whom we have treated, still every day we make phone call asking them every alternate day. They get irritated. So nowadays we are making once in 5 days. Talk to them and how do they feel. Vyagradi Kashayam is also very effective. Tamil Nadu government is giving Vyagradi Kashayam, a simple Kashayam. Prakshebam is very important in this yoga. Kushmanda Rasayanam, Agastya Rasayanam, Shavana Prasalayam, Tippali Rasayanam, Lehyam. The preparation, it is Lehyam, not our Vardhamana Vippali. In the Andagradam, Srodasam Tam Vishodhana Namburi sir used to say, when I and Namburi sir went to Coimbatore for a class in Tattva Prakashini, I think, Sar was teaching me Kushmantam is Vadapitta Samanam. When there is Agni Vriddhi is there, Kushmantam, Agni Mandhyam, from that Agastya Haridagi, Vasishta Haridagi, all these yogas are coming. But Kushmantam and Agastya Rasayanam, we did not get an opportunity to try. But government hospitals, Tamil Nadu government hospitals, they are giving Kushmandam and Agastya Rasayanam, Indugandam Kashayam were given. Diabetic patients, we were monitoring, kept fasting less than 110, postprandial 150. Every day before bed, sleeping time, sugar was kept around 140. So diabetic patients were given wheat kanji, ragi kanji, small lentils, fenugreek were there, and Nishakadagadi, Niruriadi, Gudiga, Kadagadi was supplemented. So all these things, Mukka Mukkaduadi is one of the good yogas. Yoshadi Vadagam is another good yoga. Based on the avastha, you should be very close watching, because I always tell these Vada Pitta and Pitta Vada are different. Pitta Kapha and Kapha Pitta are different. Vada Kapha and Kapha Vada are different. In Vada Pittam is gastritis. We will be giving Kushmandam. Pitta Vadam is vertigo. We will be giving Draksha. And Pitta Kapham is herpes, where we will be giving Guduji. Kaphavittam, eczema, Visarchika, we will be giving Kashayarasam, Aragvadam. Vadakafam, stroke, and in COVID also Vadakafam, which are Vadakafam, we have so many medicines, Ashtavargam, Dhanayana, etc. Kafavadam, the Samarodatariyam, Vyagradi, Patyakustumbradi, all these Kashayas, Tudulai, Kasamardam, all these things were given. Pitta Avastha also seen there, Shadangam and Sudarsanam worked very well. Conclusion: an integrated approach is need of our early screening and a good assessment is needed. Many of the cases we can manage independently. 7 days, things become negative. In comorbidity, things become negative in 10 to 12 days. But CT changes, subjective changes came late, objective changes came quickly. And Daru Nagaradi, we liked it very much. Patyakustumbradi and Daru Nagaradi. Kindly do not mistake me and don't get angry with me. Patyakustumbradi and Daru Nagaradi are slightly better than Indugandam in producing the results. Modern medicine had a fair share, and recovering patients, both critical and otherwise. We got an opportunity to witness the untiring efforts of nurses, the allopathic doctors with whom we worked. The integrated approach is possible here, and Ayurveda has got limitations also. It is difficult for Ayurvedic physician to handle people with very low oxygen saturation, oxygen less than 87. We had difficulties. Patient came by 10 o'clock and 56% was saturation. 2:30 he died, and 2 deaths were observed in the study during the period of 1 month. and no change in renal parameters, LFT, our medicine did not produce any toxicity. Ayurveda is very effective, but it cannot give complete eradication to this pandemic alone, as we think or imagine, because some cases are failures also. We had good success and little failures. Failures are coming in every side, and we should also accept that. Probably it may be due to my wrong selection of drug, my inability, because I am also new to this. Sannivada Jwaram I have studied, and Kaphavada Jwaram we have studied. So recovery rate is very fast. The wonderful thing what I have to conclude in this study is none of our patients has got post-viral myalgia and chronic fatigability. People who were on zinc and calcium, this vitamin C, synthetic vitamin C, many people still they were telling extreme fatigability and tiredness and arthralgia and myalgia. Not even a single, due to God's grace, Nandari Bhagavan's grace, Guru's grace. These people still we are not talking about the cases which recover spontaneously by hot water alone. Prananam avalambanam, Vada kapakaram, even Ushna Jala is needed in some cases, that alone is needed. Severe cases need allopathic support. If allopathic support is there, things are easier. But up to 70% without allopathic support, we can manage. Terminal cases, if you want to handle, you need training and support of modern doctors. The quarrel between Ayurveda and allopathy should come to an end. An intelligent, knowledgeable, practically successful, skillful Ayurvedic physician can very well interact, work together with a super specialty Western medicine doctor without losing its own commitments in Ayurveda. This is what we observed in working there. Vaccine will give a global solution if it is invented, and there will be side effects. Definitely, if there is effect, there will be side effects. But study what I did is only 50 cases. Patients are coming. Nobody is wearing the mask properly. They are wearing the mask for mandible, and we tell them close half the lips. I tell them close the. Now I have created a glass chamber like Kuti Praveshika Rasayana. I am sitting inside the glass chamber, and with like the mic, the bang, I am sitting inside and talking. No Nadi Pariksha, no Sparshana Pariksha. Only Shamana Chikitsa is going on because we have to take care of ourselves. So we were giving Lada Payam, Yusham, Navanga Yusham, Ragi Gruyal, Wheat Rava Gruyal, Mudga Yusham, Aingaya Kanji, Brigadi Pala, Kakamachi, Nimba Pushpa, Bimbi seeds, curry leaves, Ingu. It was prepared for Joradisara and Amrudottaram Kashayam, Shadangavaniyam, Barangyadi, Brigatyadi. All these things were ready in the hospital. Ushiradi Kashayam may be new to you. Ushiram, Balagam, Musta, Danigam, Sundi, Lajjalu, Dadagi, Lodra, Vilvabala, Majja. Diarrhea with fever and Joram. It is given. All these other items, there is no need to tell in Kerala for North India and other classes, all these Shastrik, Dosha Vigalpa, Guna Vigalpa, Amsamsa Kalpana, I used to do, and Sandra Prabhavadi, Sudarsanavadi, Shundi, Vettamaran, Vettu is febrile fits, Maran, it will almost mimic Ananda Bhairavarasam, it is a Tamil Yogam, Vilvadi Gudiga. Grinding is very important, goat's urine be added and grinded very well. Is one of the practicals for our Gurukula students. And Indaganda Girdam, Savanaprasam. Susruta did not talk about Savanaprasam. All these things we were standard doses based on the protocols. Diet chart. People who were without symptoms, they enjoyed the diet because sambar and tulasi juice, masal tea, idiyappam, vegetable curry, cumin soup, all these things were given. Tuduvalai, Kasamardam soup was given. Panagam was given. So I thank the people who sponsored and supported me to take the test, and who gave me the food, who gave the money to do the test for the poor people. I thank one and all, and I thank my gurus, M.R. Vasudevan Nambudiri. I remember Dr. Vaidyanathan sir with gratitude, Shankarangutti sir, and all others whom under Shamakrishnan, Sri Kumar, with all the team. I remember my golden days in Trivandrum, and still we are treating. We have success and failure. 70% success is there. 30% in some cases the medicines were not effective. Allopathy, they treated, the medicines were effective for them in some cases. So we are getting mixed results. But in certain areas like mild, moderate, comorbidities with stage 1, and for prevention of complications, I have done this study and I say drugs is effective. With these humble words, I dedicate this work to my guru, beloved guru, M.R. Vasudevan Nambudiri sir. Sir, if I have told anything wrong, kindly forgive me, sir.
Thank you, Dr. Mahadevan, for presenting a great paper, because your hands-on training, you explained very well, using the pure Ayurvedic medicines alone, because we all know that in immunocompromised cases and severe cases, Ayurveda may not be effective, but in those cases also, we tried our best. We show that your commitment towards Ayurveda. Definitely, I am very grateful to you. Actually, I am a bit jealousy also, because, you know, in Kerala, we are not able to treat inpatients here because the government is not permitting. Anyway, in the near future, definitely these kinds of presentations from other doctors from other states also definitely will open the eyes of our government also. Definitely, we will get in near future. We will also get chance for presenting. Definitely, I think. Anyway, this was a wonderful presentation, and with knowing the limitations of Ayurveda, maximum effect can be was able to provide to the patients. Definitely, this is a great boon to Ayurveda. Thank you, doctor. Thank you. I very much appreciate your class.
Thank you, sir. Sir, whatever I did, I studied from Kerala. The medicines belong to Kerala. The knowledge was given by you, sir. It is you who trained me. You trained me, sir.
No. You practically used it very well, and your commitment towards Ayurveda is great.
Thank you, sir.
No doubt.
Thank you, sir. Thank you, sir. Continue, sir.
No. Vinod, anything to say, Dr. Vinod?
Vinod, sir. Namaste, sir.
Yes, namaste.
Namaste.
Dr. Rajesh, any questions?
Sir, one question. What is the treatment for Garphini and children with COVID?
Children, same thing. Gobi Chandana, Adigudiga, Mukka, Mukkadu, Adigudiga, Indugandam Kashayam, Vyagradi were given. Garbhini, I didn't treat, sir. I did not get a
Not
chance.
Grahani, with
Garbhini, I didn't treat.
what is the question? Grahani.
Garbhini. COVID, Garbhini patients with COVID, I didn't treat, sir.
No. Children with Grahani. Rajesh, repeat the question once more.
Question is coming here.
And the next question, sir. COPD patients, what precautions can be taken, sir?
Kledam Abhishanti should be avoided. Ushna Prayoga, Shida Pradigaraga, Ushneja Ushna Nivaranam. Ushna Prakriya should be, Dadi, Divasopnam should be avoided. And Shida Varjida, Ushna Prayogas, Ushna Jala Prayoga, all these things are very important. Samanya Kapha, anti-Kapha, anti-Abhishanti Patyas, anti-Kleda Patya is what is important in COPD.
Dr. Vasanthi have you can ask.
Am I audible?
Audible, madam.
Yes. Thank you, Doctor. Thank you, Dr. Mahadevan. I know you very well from last 15 years. Thank you, our Nambudiri sir. I shall speak in sometimes Malayalam also, no problem.
No problem, madam.
I was directed by my institution. From April onwards, I am making documents for the post-COVID patients in foreign, because our institution managing only foreigners. So many things they want. They want also മലയാളത്തിൽ പറയാം ഓൺലൈൻ കൺസൾട്ടേഷൻ ആവശ്യപ്പെട്ടിരുന്നു. പക്ഷെ ഞാൻ ചെയ്യാൻ തയ്യാറായില്ല, ബിക്കോസ് അങ്ങേപ്പോലുള്ള അറിവുള്ള ആൾക്കാരൊക്കെ ഉള്ള സമയത്ത് എനിക്ക് ധൈര്യം വന്നില്ല. പിന്നെ അന്ന് ഇത് കുറച്ച് പിത്തവർദ്ധക ആ ഒരു ചാൻസ് ആയിരുന്നു. പിന്നെയാണ് കഫവാത ജ്വരം എന്നുള്ളൊരു രീതിയിലേക്ക് വന്നത്. ഒരു ഏപ്രിൽ മാസമാണ് ഞാൻ പറയുന്ന കാലം. ഏതായാലും ഞാൻ കുറെ ഡോക്യുമെന്റ്സ് ഉണ്ടാക്കി. ദൈവാനുത ഇമ്മ്യൂണോ മോഡുലേറ്റഡ് ഡ്രഗ്സ്, ഹെർബ്സ്, ആൻഡ് സ്പെഷ്യൽ യോഗ, രസായന പ്രയോഗം. ഏതാണ്ട് ഇപ്പം സാറ് പറഞ്ഞതിൽ പസ്ത്യാകുസ്തുപരാതി കഷായം കവർ ചെയ്തിട്ടില്ല. ഇങ്ങനെ കുറെ മെഡിസിൻസ് ഫാർമിയാതി അതൊന്നും എനിക്കന്ന് അറിയത്തുമില്ലായിരുന്നു. ഒന്നാമതെ കോവിഡ് ട്രീറ്റ്മെന്റ് ചെയ്തിട്ടില്ല, ഭൂകമ്പ പ്രയോഗം ഉണ്ടായിരുന്നില്ല. ബാക്കി എല്ലാം തന്നെ കവർ ചെയ്ത് ധാരാളം കോമോർബിഡിറ്റീസ് ഈ കോവിഡിന് ശേഷം ഫോറിനേഴ്സ് അനുഭവിക്കുന്നുണ്ട്. മെയിൻ ആയിട്ടുള്ളത് ആർത്രalgia, ഫൈബ്രോമയാൾജിയ, കുറെ കംപ്ലൈന്റ്സ് അവർ ആവശ്യപ്പെട്ടിരുന്നു. അപ്പൊ ഓൺലൈനായിട്ടല്ല അവര്, നമ്മുടെ മാഡം നമുക്ക് മെസ്സേജ് അയക്കും, അതനുസരിച്ച് നമ്മൾ ഡോക്യുമെന്റ്സ് തയ്യാറാക്കി കൊടുത്തു. പക്ഷെ ഒരു പേഷ്യന്റിനെ പോലും കാണാനോ ട്രീറ്റ് ചെയ്യാനോ പറ്റിയിട്ടില്ല. ഞാൻ ഡോക്ടർ പ്രസാദിനോടൊക്കെ സംസാരിക്കുമായിരുന്നു, നമുക്ക് എവിടെയെങ്കിലും ഒരു സെന്റർ ആയുർവേദക്കാർക്ക് മാത്രമായിട്ട് ചെയ്യാൻ. ഞാൻ എന്റെ വിറ്റ ഹോസ്പിറ്റൽ പോലും ചൂണ്ടിക്കാണിച്ചിരുന്നു നമുക്ക് ചെയ്യാന്ന്. അല്ല, അങ്ങ് ഭാഗ്യവാനാണ്. താങ്ക് യു വെരി മച്ച്. ജയ് ആയുർവേദ.
Thank you. Namaste.
Dr. Manoj Agarwal.
Sir, good evening from Kolkata. My gratitude to you and Namudri sir.
Thank you.
Hello. Sir, Pranam sir. I'm from
Pranam.
Kolkata. I'm your
Pranam.
student.
Thank you.
Sir, I have treated a lot of cases, even at home, sir. And use of Tralok Chintamani Ras, Swaskas Chintamani Ras, and also Vasant Malti Ras gave very good results.
Yes.
In those cases who need ventilators.
Very good. Very
But
good.
even at home treatment with 10 liters or 8 liters of oxygen, patient maintained to came out from that serious conditions.
Very good.
And I have repeatedly sent you a lot of SMS and WhatsApps to you also.
Yeah,
But,
you only send it to me. Okay.
And sir, variety cases also I have sent it to you regarding my clinical experience and your knowledge also for help.
Thank you.
Sir, here I want to know a few things. A few cases, 3-4 cases, I am getting pneumonitis, long-term pneumonitis for 1.5 months or 2 months, even after using many drugs. All patients are aging above 50, and they don't have any. Few patients have history of COPD. Few patients don't have any history of COPD. All the patients have diabetic history. All of them having diabetes, and they have 1.5 months to 2 months of continuous pneumonitis without having any other symptoms, without having any cough, without having any fever, without having this. The last drug I'm using is Vasha Avle, along with the rest of the medicine. Chandraprabha was also very good drug that I've selected. I need your help, sir.
Same thing, based on the avastha, you can select the medicines available there. Legium, Joram is a whole and complete chapter. So Asavam, Arishtam, all these prayogam, you take Deepanam, Bhajanam, Rukshanam, Sneganam, Svedanam, Vamanam, Virejanam, Vasti, all the avasthas, Amavastha, Paschimana-avastha, Antarvega-avastha, everything is available. But Jora Chikitsa does not contain Legya Kalpana. Jora Chikitsa does not contain Legya Kalpana because Gudam is Kleda Vardhanam. So Legium is given, Vasavalekam you are given. You cannot give in these Mamavastha, Ashgari-avastha, Paschimana-avastha. After that phase is over, only Legium comes. So Vasadi Legium you have given, it is effective, but Legium comes in the later phase. Legium can be given. Based on the avastha, you can select the medicines. Medicine choices, we have so many. What is for a study, we cannot going on changing the drugs. Allopathic hospital, they gave permission. That itself is a big thing. So we tried, we told everything. Now we got ethical committee clearance also. The Tamil Nadu government ethical committee clearance. Do it in the government hospital, the same study. So we will be doing it in the government Ayurveda Medical College Hospital. The study will be shifted and it will be continued there. Remaining things you can talk to me. We will have personal long discussions. Anoji, we will Calcutta, we will discuss.
Okay, sir. There is another question. What is the role of Annabedi for low oxygen level?
ഈ രസപ്പാണ്ടുവിലൊക്കെ അന്നവേദി കാസീസം ഈസ് എഫക്റ്റീവ്, ബട്ട് കൊടുക്കാനുള്ള ഓപ്പർച്യൂണിറ്റി എനിക്ക് കിട്ടിയില്ല. അത് ആ സമയത്ത് ഒരു ആശുകാരി അവസ്ഥ തമകശ്വാസം പോലെയാണ് ഞാൻ ചികിത്സിച്ചത്. കസ്തൂരി ഗുളിക, ഗോരോചനാദി, ശ്വാസാനന്ദം, കർപ്പൂരതൈലം, അങ്ങനെയാണ് ഞാൻ ചികിത്സ ചെയ്തത്. മുഹുർ പ്രയോഗം ഓഫ് നയോപായം. അന്നവേദി കൊടുക്കാൻ ആ അവസ്ഥ, ശ്വാസപ്രകരണത്തില് അന്നവേദി ഇല്ലല്ലോ, പാണ്ഡുപ്രകരണത്തിലല്ലേ വരുന്നത് കാസീസം. അത് കൊടുത്ത് നോക്കാൻ ഓപ്പർച്യൂണിറ്റി കിട്ടുമെങ്കിൽ അത് നമുക്ക് ട്രൈ ചെയ്യാനുള്ളതാണ്. ഇറ്റ് ക്യാൻ ബി ട്രൈഡ്.
Is there any role for Gomutra in COVID?
Sir, this is a new area, new disease. If you get an opportunity, then we can try. Gomutra means Kadurasa, Kaduvaga, Ushnavirya, Kafavadagara, Pramadi, Vevai, Anabhishanti. So it can be tried.
Dr. Krishna, you can ask the question directly. Dr. Krishna.
Hello, sir. Can I speak in Malayalam?
Yeah, Malayalathi പറഞ്ഞോളൂ.
Sir, ഈ ശീതാംശരസ ഗുളിക അത് കോവിഡിന്റെ മാനേജ്മെന്റിന് എങ്ങനെയാണ് നമുക്ക് കൊടുക്കാൻ പറ്റുമോ അത്?
ശീതാംശരസം ഞാൻ എവിടെയോ വായിച്ചിട്ടുണ്ട്, ഇപ്പോഴെനിക്ക് ഓർമ്മയില്ല. ഗന്ധകം ചേരുന്ന മരുന്നാണോ?
ഹരിതാലൊക്കെ ഉണ്ട്, ശുണ്ഠി, ഹരിതാല, പിന്നെ
ഹരിതാളം ചേരുന്നു. ഞാൻ വായിച്ചിട്ടുണ്ട്, വൈദ്യയോഗരത്നാവളിയിൽ ഞാൻ വായിച്ചിട്ടുണ്ട്, പണ്ട് കൊടുത്തിട്ടുള്ളതാ. കൊടുക്കുന്നത് തെറ്റൊന്നുമില്ല. അവസ്ഥ ആൻഡ് അവൈലബിലിറ്റി യു ട്രീറ്റ്. What I have done, I have told. Based on the availability, if you get an opportunity and if your yukti compromise, if your yukti synchronize with that, you treat. Haridhalam is an agre aushadha for tamakaswasam. Pushmanda shodhanam, I remember.
Yes.
We do it with abraga. It can be given.
Okay, sir. Thank you.
One more question, sir. Final question is the management of post-COVID.
After Jara Vimukta, all these Madhura Rasa Pradhanya comes there. Vidaryadi, Drakshadi, Indagandagradam, Pushmandalegam, Shavanaprasam, Madhuram, Vadavitta Shamanam, Brahmanam, Snehanam. Like that, treatment should end. If Amam is there, you can do. Then this Danyamaladhara and all for myalgia, we are doing in 1 or 2 cases of negative, there is body pain. Dasamuladhara. Like that, based on the yukti, these simple things can be done. Pranayama is effective. Pranayama did not prevent actually. Some people who did pranayama also got. Some people who took amalagi also got. Some people who did not take Savanaprasam also got. Different documentation is happening. Students are telling. So till what exactly is happening in this Samprapti, we do not know. Depression and insulin.
Sir, one more question. How do you address manasika vigaras in COVID positive cases?
Counseling, sir. Tideri Atmadi Vijnanam. We were talking positively. First month, our people were very much afraid, and I had to counsel the doctors to go to the ICU, and then counseling. And the people are also now, they are not very much afraid or serious. Death rate has come down slowly. But only by talking and reassuring them, showing them. And some people from other ward, they started coming to us and asking, give me Ayurvedic medicines, give us Ayurvedic medicines, because they were seeing special diet were given and these medicines were given. So they were asking, give me Ayurvedic medicines. Then they came to our OPD here and asked for medicine. And the cardiologist was very kind to give, start an OPD there, Ayurvedic OPD in an allopathic hospital for COVID. It's going on. So we can, based on the avastha, you can manage, sir. Simple things. You have asked about CRP. Once Dhatu Bhagam comes down, inflammation comes down, Vidagdhavastha comes down, Amavastha comes down, CRP and ESR will come down.
There is a question of emergency management in severe breathlessness.
That only modern doctors, they did it. We were watching.
Okay, sir. Sir, questions കഴിഞ്ഞിട്ടുണ്ട്.
Thank you, Mahadevan, Dr. Mahadevan, for your excellent presentation. Very convincing presentation with all data and your classification of different groups is very excellent. And you also described how to manage COVID patients with diabetes, with hypertension, with renal dysfunction. These are all very essential things you give to our doctors, and you are lucky to get so many patients there, as Namburi sir told. Nothing more to say. Everything is very clear. So, on behalf of Ayurveda Medical Association, I extend our sincere thanks to Dr. Mahadevan for this excellent presentation, and very much thankful to Dr. Kumar Vasudevan Nambudri sir for his great presence and good words, motivating words. Thank you, all the participants. Thank you.
Thank you very much. I thank Saju for making these wonderful documentations and making slides and helping me. Thank you very much.
Okay. കഴിഞ്ഞു ഡോക്ടർ സൈനു ക്ലോസ് ചെയ്യല്ലേ രാജേഷ്? രാജേഷ്